I've always been fascinated by how horses manage to sleep standing up. It's such an incredible feat of nature,
It
right?
really is.
They have this amazing kind of built-in anatomical locking system that allows them to do it with almost no muscular effort. But what happens when that perfectly designed system hits a snag?
Yeah, that's a great question.
Today, we're taking a deep dive into a really intriguing, yet often confusing, orthopedic challenge in horses known as stifle lock, or for those in the know, upward patellar fixation, UFP.
Exactly. And at its core, UFP is, well, it's a mechanical issue where the horse's kneecap, which we call the patella, temporarily or sometimes persistently gets caught.
Gets caught. Okay.
And when that happens, it directly prevents the normal bending or flexion of their hind limb. It's a significant condition that can really impact a horse's movement and comfort.
Right. And our mission in this deep dive is to unravel all of its complexities for you. We're going to cover everything from the ingenious way a horse's leg usually works, what goes wrong with UFP, how vets figure it out, and the exciting new ways it's treated.
We'll cover the whole picture.
Think of this as your essential guide to truly understanding equine stifle lock. So let's talk about Spirit. A hypothetical young horse, a lively jumper, whose owner started noticing something a little off in his hind end. Spirit's story will help us connect these complex pieces.
That sounds like a good way to frame it.
Okay, let's unpack what upward patellar fixation actually is. Essentially, it's when the patella, that kneecap we just mentioned, gets caught or snagged on a specific bony ridge on the thigh bone.
That's the medial trochlear ridge of the femur.
Right, that one. When it gets stuck there, it literally blocks the hind limb from bending properly.
And this condition isn't just one thing, it exists on a spectrum. On one end, you have what we call complete or persistent UFP. This is the really dramatic form.
Oh, okay.
The hind limb is rigidly locked straight out. The horse just can't bend their knee or hock and often drags their toe along the ground.
Wow.
As you can imagine, this is incredibly debilitating and severely limits their movement.
That sounds pretty alarming. So what about Spirit? You mentioned he wasn't dragging his toe constantly.
No, exactly. That's where the more prevalent and often subtler form comes in. Intermittent UFP, sometimes called delayed patellar release.
Delayed release, okay.
In these cases, the patella momentarily catches before releasing with a sort of jerky, exaggerated flexion of the stifle and hock. You might even hear an audible click or clunk, and that's often what Spirit's owner first heard.
Ah, that little sound.
Yeah. This intermittent catching is frequently observed during specific movement state transitions, from a trot to a walk when a horse circles, or when working on challenging terrains like deep footing or slopes.
Right.
These jerky movements and sounds are critical because they strongly indicate it's a mechanical issue, a physical hitch, rather than, say, a nerve problem.
So why does this matter beyond the obvious lameness, especially in milder cases like Spirit's?
Well, even these subtle forms of UFP can have a really substantial impact on a horse's athletic performance. Horses might show a reluctance to canter in a specific direction or on a certain lead, or they might end up taking the wrong lead. Spirit, for instance, started having that bouncy, rough canter stride that was really difficult for his rider to sit through.
Yeah, I can imagine that's frustrating.
Definitely.
Yeah.
And if we connect this to the bigger picture, if stifle lock is left unmanaged, it can lead to progressive secondary complications.
Like what?
Well, prolonged catching and friction can cause inflammation of the stifle joint itself, which we call gonitis. And in severe, long-standing cases, it can even predispose a horse to more severe issues like hip dislocation, particularly in smaller breeds like Shetland ponies.
Oh, wow.
So it really underscores how vital early recognition and intervention are for long-term health and soundness.
Okay, that makes sense. Now let's zoom in on the fascinating engineering of the equine stifle joint. You can actually compare it to the human knee, but it has some truly unique features.
It really does.
It's made up of three primary bones. The femur, that's the thigh bone, the patella, the kneecap, and the tibia, the shin bone. And what's incredible is that it's the largest synovial joint in the horse's body.
Huge joint.
Yeah. The patella itself sits within a specific pathway called the trochlear groove of the femur. And helping to stabilize all of this are three patellar ligaments, with the medial patellar ligament playing the most significant role, especially when it interacts with that prominent bony ridge on the thigh bone.
And what's truly fascinating here is how all of these components work together in the horse's unique stay apparatus.
Yeah, the sleeping standing up thing.
Exactly. This is a passive system that allows horses to rest and even sleep standing up with minimal muscular exertion. In a hind limb, that medial patellar ligament essentially hooks or locks over that prominent bony ridge of the femur we just talked about.
So it just catches on purpose, normally?
Precisely. This creates a stable, weight-bearing column, allowing the horse to bear weight without active muscular effort. It's a brilliant natural design for energy conservation.
Okay, here's where it gets really interesting and why Spirit's entire leg seems stiff. The stifle joint isn't an isolated unit. It's intricately linked to the hock and fetlock joints through something called the reciprocal apparatus.
That's key.
This system ensures that the stifle, hock, and fetlock all flex and extend in a synchronized manner. So, the key takeaway here is that if the stifle gets locked, the entire hind limb is forced to move as a single stiff unit.
Like one solid piece.
Exactly. That's why you see that characteristic toe-dragging gait in more severe cases. It's like a finely tuned machine, and if one gear jams, the whole mechanism is affected.
Normally, to unlock the limb and allow for flexion, a specific muscle group, the quadriceps femoris, actively contracts, lifting the patella. Simultaneously, another muscle, the biceps femoris, contributes to a subtle turning action of the patella, allowing it to disengage and move back into its normal position.
So it lifts and turns.
Right. The problem in UFP, then, is a failure of this crucial unlocking mechanism. One prevailing hypothesis suggests this persistent locking might stem from a sort of spasmodic activity of a specific quadriceps muscle, the vastus medialis.
A muscle spasm keeps it locked.
That's one theory, yeah.
Yeah.
A failure in the coordination.
So what are the ripple effects of this functional failure? What happens downstream?
Well, repeated locking or even delayed release, like Spirit experienced, can cause increased friction between the patella and the femur. This leads to soreness and inflammation, that condition we called ganitis, or stifle joint inflammation.
Okay, the irritation.
Exactly. Over time, this chronic irritation can strain the patellar ligaments and contribute to the development of painful osteoarthritis within the stifle joint itself. This really underscores that UFP is a dynamic functional failure, a jam in the system, rather than just a static structural anomaly.
Right. It's about how it works or doesn't work.
Precisely. This naturally raises an important question. What makes some horses more susceptible to UFP than others? It's often a complex interplay of their natural body shape, their muscular condition, age, and even breed.
Okay, let's start with conformation, or how a horse is built.
Sure.
Horses with what vets call a straight pelvic limb conformation are recognized to be at an elevated risk. This particular alignment can cause the patella to sit higher than it should, making it more prone to becoming entrapped during movement.
That alignment matters.
And it's not just the limb angle. Poor or misshapen hindfoot conformation also plays a significant role. Specifically, things like long toes or a higher inside wall of the hindfoot can alter the horse's natural foot flight.
How the foot lands and lifts off.
Yeah, creating abnormal biomechanics that can strain the patellar apparatus and surrounding musculature, so the feet are involved too.
Absolutely. And the strength and integrity of the quadriceps muscle group are absolutely paramount for the proper functioning of that patellar unlocking mechanism we discussed.
The main engine for unlock.
Exactly. So horses with poor quadriceps muscle tone, whether from insufficient training, inadequate conditioning, or prolonged stall confinement, are significantly predisposed to UFP.
Makes sense. Weak muscles can't do the job.
Conversely, and this is a key takeaway, a targeted increase in exercise and a general improvement in muscle tone can often resolve or significantly improve UFP, especially in milder cases like Spirit's, and particularly in young animals.
So getting them fitter can fix it sometimes.
Often, yes. It highlights how profoundly a horse's overall fitness level influences this condition.
Okay. And when we look at age and breed,
UFP is frequently observed in young, immature, and untrained horses. Many of them actually grow out of the condition as their muscles develop and strengthen with work and maturity.
so Spirit might have just needed more time and training?
Potentially, yes. But adult horses can also acquire it, particularly if they experience rapid muscle loss due to extended stall confinement or inactivity.
Ah, like after an injury layoff.
Exactly. And there's a recognized genetic predisposition, with certain small breeds like Shetland and miniature ponies being overrepresented, though you see it in larger breeds too. Warm bloods, thoroughbreds, standardbreds are also mentioned.
So it's across the board, but maybe more common in some.
That seems to be the case. The clinical presentation of UFP is highly variable, though. It encompasses a wide range of signs, and this variability requires a truly discerning eye from the vet to avoid misdiagnosis. as it can mimic other issues.
Right. So for mild or intermittent UFP, that delayed patella release that Spirit experienced, what would you actually see?
You might see a subtle delay in stifle flexion, resulting in that characteristic jerky gait.
The hitch.
Yeah, the hitch. There's often a palpable and sometimes audible click or clunk as the patella releases. Horses might show that reluctance to canter in a particular direction or on a specific lead.
Picking up the wrong lead, maybe.
Exactly, or displaying a notably bouncy or rough canter. Stumbling in the hind end is a common complaint, which can even lead to front limb stumbling and falls sometimes.
Yep.
It can be. And the lameness often improves with exercise as the horse warms up, but it's more pronounced at the start of exercise or when asked to back up. So if you notice any of these signs, consider them red flags.
Okay. Subtle but important clues.
In contrast, the signs of severe or complete UFP, the persistent locking, are much more striking. The hind limb becomes rigidly fixed in extension,
Just stuck straight out.
stuck straight out, causing the horse to drag the toe of the hoof along the ground. In severe cases, the horse may even hop along on 3 legs until an abrupt release occurs.
Oh, wow.
The affected limb may be carried in what we call a caudally abducted position, sort of outward and backward.
Mhm.
And you'll often see excessive wear of the toe of the hoof or shoe from the persistent dragging.
You'd notice that on the hoof.
Definitely. These horses may also show reluctance to work on soft, deep surfaces or when navigating inclines or declines.
So what's critical to understand is that these variable and sometimes subtle signs mean UFP can mimic other hind limb lamenesses, like string halt, which is a neurological condition causing exaggerated limb flexion.
Completely different cause. Similar look sometimes.
Right. This really highlights the critical need for a thorough and differential diagnostic approach by veterinarian. You can't just assume.
Absolutely not. Accurate UFP diagnosis requires a multifaceted approach, combining a careful physical examination with various imaging techniques.
So with that clear picture of what UFP is and how it presents, how do vets actually confirm it, since it's dynamic, happening during movement?
Right. Simply standing still for an exam often isn't enough.
So vets use specific provocative maneuvers to try and make the lock happen.
Exactly. We'll observe the horse at a slow trot for those jerky movements. Asking the horse to back up is often highly effective, as it frequently accentuates or even induces the lock.
Ah, like with Spirit's vet.
Precisely. Turning in tight circles, especially toward the affected limb, can also provoke the characteristic catching or locking. Repeated stops and starts and walking down a slope are also used to make the UFP more apparent.
Trying to trigger it.
Yeah. Vets might even manually manipulate the patella, trying to gently force it upward and outward to see if they can induce a lock, and they'll always check the toe of the involved hoof for that excessive wear we mentioned.
Putting all the clues together.
Diagnostic imaging plays a crucial role here too, primarily for assessing any secondary changes and ruling out other problems.
So, x-rays.
Radiography, or
Right.
x-rays, yes. They're used to assess bony changes. Their main purpose isn't really to see the lock itself, but to identify secondary issues like bone chips, patellar fragmentation, or early arthritis, and importantly, to rule out other primary skeletal conditions.
Make sure nothing else is going on.
Correct. They also help assess hind foot balance, which we know can be a predisposing factor. Then there's ultrasonography.
Ultrasound, okay.
That's invaluable for looking at soft tissue structures, especially the patellar ligaments, which aren't visible on x-rays. It helps assess thickening, fluid accumulation, or fiber disorganization in those ligaments.
So you can see the ligaments themselves?
Yes, but what's important to understand here is that recent research indicates some hypoechoic or dark regions on ultrasound can actually be normal anatomical variations.
So a dark spot isn't automatically bad.
Not necessarily. The clinical signs must always be correlated with the imaging findings. You need the whole picture.
Got it. And more advanced stuff.
For more complex cases, advanced imaging like scintigraphy or a bone scan can highlight areas of inflammation or increase bone turnover, and arthroscopy.
The camera in the joint.
Exactly. It offers direct visual confirmation of joint pathologies like cartilage damage and allows for immediate surgical intervention if needed.
Okay, so what does this all mean for a horse like Spirit affected by UFP? The treatment path, it must depend, right?
It depends heavily on the severity and how long the condition has been present, the horse's age, and, importantly, their athletic demand.
Right, what they need to do.
We typically start with conservative management, especially for young horses or those with mild or intermittent cases, like Spirit, potentially.
What does that involve?
Strengthening the quadriceps muscle group is paramount here, as it's essential for active disengagement of the patella. So prolonged stall rest is generally not recommended.
Bad idea.
Usually, yes, because it can lead to muscle atrophy and worsen the condition. Instead, turnout to pasture is often recommended, along with targeted exercises.
Like what kind of exercises?
Think working in an extended forward trot, riding up and down hills, working in deep footing or shallow water, and trotting over cavaletti poles, things that encourage exaggerated stifle and hock flexion.
Make those muscles work. Spirit's owner found hill work helpful, you said.
Yes, that's a common one that helps. Corrective shoeing and trimming are also critical. Manipulating hoof balance by shortening the toe, elevating the lateral heel, or using bevel-edged shoes can significantly reduce stress on the patellar apparatus and facilitate normal movement.
So the farrier is key.
Absolutely. Close collaboration with a knowledgeable farrier is vital. Another approach, though, with more variable results, is paraligamentous injections.
Injections around the ligament.
Yes. Substances like iodine-based products are injected around the medial and middle patellar ligaments. The idea is to induce controlled inflammation, which then leads to thickening and shortening of the ligament, hopefully helping it stay in place.
Kind of scarring it up a bit.
In a controlled way, yes. However, results can be unpredictable, and there's a definite risk of complications if the injection inadvertently enters the joint itself. So it needs careful technique.
Right. Got to be precise.
There are other conservative therapies mentioned sometimes, like estrogen compounds or joint supplements, but the scientific evidence for them is often more variable.
Okay. So when conservative approaches just aren't enough, or for those severe, persistent cases where the horse is truly locked, surgery.
Yes, surgical interventions become necessary then. The two primary procedures are medial patellar ligament splitting, or MPLS, and the more traditional medial patellar desmotomy, or MPD.
MPLS and MPD. Let's start with MPLS.
Okay, medial patellar ligament splitting, MPLS, has really emerged as a highly effective and minimally invasive procedure.
Minimally invasive sounds good.
It is. It involves making multiple tiny stab incisions into the medial patellar ligament, often performed with the horse standing, under light sedation and local anesthesia, sometimes even with ultrasound guidance for precision.
Just little nicks in the ligament.
Essentially, yes. The mechanism is quite clever. It induces controlled, localized inflammation, which then leads to fibrosis and thickening of the ligament. This thickening prevents it from catching or locking.
Ah, similar idea to the injections, but surgical.
A more targeted surgical approach, yes.
Yeah.
And studies report excellent success rates, with over 97% of horses achieving complete resolution of UFP, often immediately or within just 2 weeks post-surgery.
97%, that's huge.
It's very high. Crucially, long-term studies, some following horses for up to 14 years, have shown no reported short or long-term complications or recurrence.
Wow, no downsides reported.
In those studies, no significant ones. This procedure also allows for a very rapid return to athletic activity, sometimes within days, positioning it as the highly favored option for many vets today.
Okay, MPLS sounds pretty amazing. So what about the other one? Medial patellar desmotomy, MPD. That's the traditional one where they cut the ligament completely.
That's correct. Historically common, but now largely considered a last resort.
Why the change, if MPLS is so good?
You're right to ask. MPD, despite being a straightforward cut and often initially effective at stopping the locking, is associated with significant and often detrimental side effects down the line.
Side effects like what?
Well, while it can achieve high initial soundness rates, approximately 30% of horses, a significant number will develop significant joint damage later on, things like cartilage fibrillation, which is fraying, or osteophyte formation bone spurs.
Arthritis, basically.
Exactly. It leads to persistent low-grade lameness or accelerated osteoarthritis in many cases. That high complication rate is why many surgeons now strongly favor less invasive alternatives like MPLS. MPD permanently alters the horse's joint mechanics in a way that can lead to these long-term issues.
Cutting that ligament changes how the whole joint works.
Permanently, it destabilizes things.
Okay, that makes the preference for MPLS very clear.
It does. And effective post-operative care and a structured rehabilitation program are absolutely paramount for optimizing outcomes following any surgical intervention, but especially important to get right, depending on the procedure.
Right, the rehab must be different. You said MPLS allows a quick return to work.
Generally, yes. For MPLS, horses typically require a very short period of stall rest, sometimes as little as 3 days, followed by a rapid reintroduction to controlled exercise like hand walking, and then gradually increasing work.
So Spirit, if you had needed MPLS, would have been back to light work very quickly.
Very likely, yes.
Yeah.
MPD, on the other hand, requires a much more prolonged rest period, typically a minimum of 6 to 8 weeks of strict stall rest, sometimes longer,
Why so much longer?
to allow for fibrosis or scar tissue to form and reestablish some stability where the ligament was cut. An early return to exercise after MPD carries a significant risk of those complications we talked about, like chondromalacia cartilage softening and osteoarthritis.
Okay, so big difference in recovery time and risk.
Huge difference. General rehabilitation principles for both, though, include a gradual increase in workload, those hind limb strengthening exercises we mentioned earlier, extended trot, hill work, deep footing, carefully managed.
Avoiding tight turns, I bet.
Yes, avoiding tight circles is important initially. And NSAIDs, the non-steroidal anti-inflammatory drugs, are commonly administered for pain management in the initial phase. Adjunctive therapies like physical therapy and continued corrective shoeing are also really essential components of postoperative management to ensure the best possible recovery.
It's a whole team effort.
Absolutely.
So bringing it all together, what's the overall prognosis for horses with UFP? Is it generally good?
Overall, yes, it's generally favorable, especially with early and appropriate intervention. But as we've discussed, the choice of treatment greatly influences the long-term outcome.
Right.
We consistently see a highly positive prognosis following MPLS, nearly 98% resolution reported in some studies, minimal to no recurrence, and that rapid return to sports.
That's the clear winner in terms of outcome.
It certainly appears to be based on current evidence. This is in sharp contrast to MPD, which, despite potentially high initial soundness rates, carries that high incidence of complications leading to persistent low-grade lameness and osteoarthritis down the road, truly making it a last resort for many veterinarians now.
Makes sense. What other factors influence the long-term outcome?
Well, age and maturity play a role. As we mentioned, young horses like Spirit may simply grow out of it with conditioning. Conformation, if underlying issues aren't addressed through corrective shoeing or management, can predispose to recurrence even after treatment.
Got to manage the whole horse.
Exactly. Muscle tone and fitness are crucial for both prevention and successful rehabilitation. And perhaps one of the most important factors is owner compliance.
Following the vet's instructions for rehab.
Absolutely vital. Sticking to the prescribed rehabilitation program is critical for successful outcomes, especially getting the exercise levels right at the right time.
As we wrap up this deep dive, it's really clear that equine upward patellar fixation is it's a complex, dynamic, functional impairment influenced by a whole host of factors.
Yep.
It's not just a simple structural defect, is it? It's a hitch in a finely tuned biological machine.
That's a great way to put it. And we've seen the significant advancements in understanding and treating UFP, particularly a crucial shift from invasive, complication-prone procedures like MPD to highly effective, minimally invasive surgical techniques like MPLS.
Yeah.
This condition, UFP, truly highlights the power of precise diagnosis and tailored treatment, demonstrating that knowledge is most valuable when it's understood and applied correctly. It's really a testament to how far veterinary medicine has come in managing these kinds of mechanical issues.
Absolutely. Now, for a final provocative thought for you, our listeners, to ponder. Considering this intricate biomechanical system in horses and how a subtle functional failure like UFP can have such profound impacts, what similar dynamic impairments might exist in other complex biological systems, or even technological systems that we currently overlook or maybe misdiagnose as purely structural problems?
Interesting question.
What could recognizing those functional failures mean for future diagnostics and treatments, even beyond the equine world? Something to think about.